Dr. Jones, Dr. Jones, a minute ago, a while ago, we talked about missing tooth and the havoc they can bring in a mouth, from headaches to neck pains to shoulder pains, never mind chewing the food not so good, which creates a whole row, and teeth becoming crooked, and by doing so, like a fence ball, other teeth starting to, in itself start to look ugly. Okay, we covered that. Now, what are the options, and have there been major improvements over the last, let's say, decade, or anyway, in order to replace a missing tooth? There's lots of names floating around, and sometimes people think that let's just say the implant or whatever, it totally replaces whatever was before. That might not be so. They may be both having their function. Tell us a little bit of what's out there.
Sure.
In terms of
Well, most people are very familiar with replacing teeth with some kind of a removable bridge that their grandparents had, or they've seen people, take in and out of their mouth, and that was fine for then, but the main problem with those kinds of appliances is when we eat, food gets underneath of them, they become loose and they wiggle around in our mouth. They actually will start to loosen other teeth, and pretty soon we have to start taking out more teeth only because that particular appliance was placed in their mouth in the first place. So over the years, the improvements have been made, but one of the biggest improvements of the last century was the invention of the dental implant. It's made out of titanium, and it actually replaces a root. So a good term would be an artificial root. And when an artificial root is placed inside either the upper jaw or the lower jaw, it does two things. One thing is it stabilizes bone loss. Helmut, when we lose a tooth, not only does it impair the function of how our teeth chew and grind our food and how we nourish ourselves, but the bone that used to be in that area, that used to support that root, will also start to dissolve away. And if you have a dental implant put in, or an artificial root, that will preserve that bone, preserve that healthy jaw bone.
So basically,
so that it doesn't.
The bone, sorry to interrupt you, the bone basically, somehow the body, if there's no root in it, it's almost like the body says, we don't need you. Almost like if you get a cast on your hand for a couple months, I don't know whether you ever had that, but I did, and then you take it off and your hand is thin like a little wire.
It's smaller. That's exactly right. Every bone needs compression and tension, whether it's our fingers or our legs, our arms. Any bone that we have needs compression or tension in order to stabilize the health of that bone. And when you take a tooth out, that particular area of the upper jaw or lower jaw no longer has that compression or tension. And so the bone starts to dissolve away. It starts to atrophy. Just little by little, starts to dissolve away.
Is that one of the reasons why, people who have a fair amount of teeth missing, they start looking like a dried out caved-in tomato?
Absolutely. Absolutely, because instead of having a jaw that might be an inch or more thick, that jaw is maybe a quarter of an inch thick, and they've lost, 3/4 of the amount of bone that they used to have. And so their face just all looks sunken in, and their cheeks are sunken in, they get wrinkles faster, because everything is starting to dissolve away. And so that is one of the most important functions of a dental implant, is to restore that health of that bone, that jawbone in that area. But the second, maybe more important, function of that artificial root is it now becomes a platform on which we can build a new tooth. In other words, it's the same as a dental crown on a tooth, that most people know what a crown is or a cap is on a tooth. We can put a cap or a crown on top of a dental implant that completely restores the function of that tooth used to have. And now the patient can chew again. And they don't have a space where other teeth will move into. So now we talked earlier about the joint stability, the jaw joint, the TMJ stability. Now that can become more stable because you don't have teeth that are moving. Now we can chew our food more functionally and totally, instead of having to chew on our front teeth.
Let's go a little bit.
So the dental implant is.
Finish your
Very,
sentence.
very helpful.
Good. Let's go a little bit.
Dental implants very helpful.
Great. Let's go into the difference a little bit, Dr. Jones, of there may be pros or cons, or maybe when needed and when one is needed or the other one is needed. Let's take let's say 3 or 4 unit bridge, which basically means you use 2 of the old teeth, you put a crown on it, and you hang a couple teeth in between, which makes it a bridge.
Correct. Absolutely.
Filling the space, and I'm sure the teeth can be adjusted for your DMJ and all that.
Absolutely.
Right?
Yes.
Good.
Yes.
Now that versus an implant, are there times when one is more preferable versus the other one, or does one last longer than the other one? Are there some handicaps which one brings with it versus the other one?
Sure.
Tell us about it.
Yeah, Helmut, and it's a great question because, we talked earlier about how do we decide what is the best treatment. You can go to a restaurant and choose from a variety of things, but in dentistry, really, what is the best, and how do we decide what that is? And it might be different. Almost similar circumstances might be different for one person than another. But in reality, Helmut, we actually weigh all of the risks and all of the benefits for both treatments, whether it's using a bridge, as you mentioned, where we crown one tooth and then there's a couple of fake teeth welded to that bridge, and we crown another tooth and span across a space with 2 false teeth, or whether we should put 2 implants. I think one of the biggest benefits of having a dental implant in place versus having a bridge, let's just say we chose to have a bridge done, and then let's say one of those teeth develops a problem 3 or 4 years down the road. We have to replace that entire 4-tooth bridge. Or if that tooth needs to be removed, now we need a bigger bridge. But if we've chosen to replace those missing teeth with a dental implant or 1 or 2 dental implants, and let's say that same problem happens and we have a problem with one of the teeth, now we only have to work on that 1 tooth. We don't have to replace the entire bridge again. So in the long run, I really do think that even though the investment is significant in the first place, down the road it is a money saver. Because I have, in many people, before implants were readily available, many people I've had to replace bridges 2 or 3 different times because of problems. And it wasn't until, in fact, one patient, I said, we could do this again in another 5 or 6 years, or you can go and get some dental implants, and now we don't have to. So 2 things happen. Number 1, we haven't had to replace any of his teeth because, a bridge is basically building a larger house on a smaller foundation. And with a dental implant, we have the proper size foundation for the proper size house, for the number of teeth that we have. If we have a 4-tooth bridge, we're putting 4 teeth on the foundation of only 2 roots. But if we put 2 dental implants in there, now we have 4 teeth on 4 roots. That is the way God intended it to be. So we don't have the collapse. We don't have the need to replace 4 more teeth if something were to happen down the line. So I think it is absolutely the best way to go. Now you ask, okay, when would we not do a bridge? Or when would we not do an implant and we would do a bridge? I have a dental implant in my mouth. I think that it's the best way to go. That's why I chose to have a dental implant. But when might we do that? If a patient is in a certain situation where they already need to have crowns on these other teeth, they already know that their financial circumstances may change down the road, then we may choose short-term to do a bridge in an area where we're planning long-term to eventually go to a dental implant. But for right now, we're replacing the teeth, we're making his mouth stable, we're getting him back to health and function, knowing might not be the best way to go, but for now it's the best. We all have to live real life. We all have to be in this place where we are, and we have to make hard decisions sometimes. That would be the place where we might choose a bridge over it.
Got it. So Dr. Jones, so basically it is still a functional way to go for a bridge. But
Absolutely.
it could be most likely, when those teeth next start collapsing, all of a sudden you need to redo it all. Now, if they're already collapsed, then you need to put already a crown and bridge, a crown on it anyway. Then that may be a time you say, okay, we need to. They're already gone anyway. We need to do what we need to do and build it up and put a crown on it. Then maybe. Now let me ask you, in terms of longevity, you see, before you said that you lose bones. So when you have 2 or 3 teeth missing, you're going to start losing bones in that area. And also, I have, tell me whether there's some truth to that. So let's say you have 3 units, 3 teeth or 4 teeth. They're kind of welded together for all purpose. They're probably not welded together, but I'm just using that word. Now, you can't really floss in between, so you need to use those, whatever they call those things which you go underneath. Now, I am somewhat a sloppy guy. Like at night, when I go, my wife and me go to the bathroom the same time, and we come out there literally an hour and a half later. We talk and talk and talk. But here's the thing. I shower, I shave, and I brush my teeth while she is only brushing. So you get the point, right? I'm not quite as dedicated as she is. Would a person like me, having one of those bridges, and probably a few times a week say, nah, not today. Today I'm done.
That's another real benefit, Helmut, of having dental implants is because you can floss your dental implants just like you floss your teeth. You don't need any special little tool. That little tool is called a bridge threader, by the way, and it does work very good, and we're glad we have them for those situations. But in the situation where a person has a dental implant to replace that tooth, and they can floss their teeth normally, just like they do every other tooth. So it doesn't take double or triple the amount of time because you have to find the little bridge threader and then you have to put it in the little space. And anybody who is listening to this that has done that or tried to do that before, they understand what I'm talking about. But with a dental implant and having a crown put in, I have a dental implant with a crown on top of it, and I floss it every day just like I floss every other one of my teeth. So it's not a problem as with the bridge threader that some people have experienced. Good point. So the periodontal health, so the gum health is actually much easier to take care of, and your hygienist will give you an A+ more often if you're flossing your dental implant than if you're not flossing with the bridge threader your bridge.
Yeah, well, never mind the dental hygienist. Just deliver the kidney, the heart, the bloodstream, the diabetes thing, the immune system.
You brought up a big point.
As we have mentioned in other videos, it will help you. Dr. Johns, again, appreciate your informative, output here. Very wonderful. Thank you.